In which case, then, welcome everybody. Thank you very much for finding the time this afternoon, actually nearly into this evening, for this extraordinary single agenda item board meeting. We all much appreciate the time that you all put into this, both in the preparation and for being here tonight. So thank you for that. Just to note that this is a public board meeting, so it is being live streamed. And also Tom is recording it just in case anything goes wrong with the live streaming, so that we can use that recording to put on the website should we need to. I'm not proposing to do introductions because I think, well, first of all, we want to progress this quite rapidly, and rather than going around a sort of 27 people meeting, I think we'll do introductions as we go along, if that's okay, everybody. So first of all, then let me come, Tom, to you for apologies, please.
Thank you, Chair. We've received apologies from Richard Watson, Caroline Donovan, Paul Jabara, Kirsten Alderson and Nick Hume.
Okay, and we've got Kath Byford for Caroline and Shane Gordon for Nick, haven't we? So that makes us quorate. So let's continue down the agenda. Go on to declarations of interest. So
Moira's hand is raised.
Oh, I beg your pardon. Thank you for that, Ed. Moira, do come in.
Apologies, just for the record, I'm here representing Pete Devlin for Essex County Council.
Oh, yes, indeed. Thank you, Moira, for pointing that out. You've been to so many meetings, we didn't spot that you were here for Pete. So thank you for that. Noted. Declarations of interest then. Are there any declarations of interest or potential conflict of interest with any agenda item other than those of which we're aware? And Tom, you'll appropriately record, I'm sure, the declarations of interest for colleagues on this specific single agenda item. I don't see any hands raised for any others, so we'll move on then to the item in question. I'm going to go first to Ed. This is to introduce the proposal for West Suffolk patients to benefit from the fantastic new state-of-the-art facility that's going to be opened at SNEFT in terms of the elective orthopaedic centre. Ed, and I know you're going to introduce colleagues to support you in this presentation. So over to you.
Thank you, Will. So before I introduce the presentation, as you say, the recovery of elective waiting lists is amongst the biggest priorities in this country at the moment. We're very, very excited that from late summer, we will not only have a state-of-the-art elective orthopaedic centre at Colchester, but it is promising to be the largest in Europe, which is incredibly exciting for us. We want all of our population to benefit from the new centre as quickly as possible. And we are going to be proposing that we conduct a public engagement exercise to ensure that we listen to all views in the community and to ensure that we get this absolutely right. And that approach has been supported by NHS England and our Health Overview and Scrutiny Committee in Suffolk. So Simon Morgan, who's our Director of Communications at the ICB, and the ICB will be leading this process, will introduce some slides alongside Mr. Andrew Dunn, who's a consultant orthopaedic surgeon, the clinical director for the new centre, and a very distinguished figure both in SNE and nationally. So over to Simon and Andrew to introduce the slides for the board.
Thank you very much indeed, Ed. Just before we do start, just a point of clarification within the board paper itself and figure 2, where we refer to the day case procedures, listing them as 50% for Colchester and 66% for West Suffolk. I just would wonder whether Paul Molyneux, if I can invite Paul just to explain those figures, please.
Absolutely, yes. So the figure should read in figure 2, 50% on both the left and right hand side of that slide in order to make sense. So apologies for that oversight.
Thank you, Paul. I'll hand over to Andrew now, please. Thank you.
Thank you, Simon, and Ed, thank you for your kind words. So it gives me great pleasure to be involved in the presentation this evening and discuss and present the proposal for West Suffolk patients and how they'll benefit from the state-of-the-art Essex and Suffolk Elective Orthopaedic Centre, which will be housed in the Dame Claire Marks building on the Colchester site at Esneft. As Ed's already alluded to, it's going to be opened in the summer. We'll have 8 theatres, 72 beds, and our ambition is to deliver 10,000 procedures a year, which will significantly reduce waiting times for patients from all over Suffolk and North East Essex. So next slide, please, Jared. Thank you. So nationally, elective care waiting lists are a major issue and a major concern. There were unprecedented levels of disruption to elective care across the country due to the pandemic, and nationally waiting lists surged by 61% from 4.57 million before the pandemic in February 2020 to 7.47 million at the start of this year. And that's largely because during the pandemic, the majority of routine care was stopped. Now, reducing the backlog and reducing waiting lists is one of the government's national priorities, and ministers set up an elective recovery task force to tackle growing waiting lists to ensure all capacity was put to its best use. Tim Briggs, who is the National Director for Improvement and Elective Recovery and the chair of the GERD programme, is on that task force. And for many years, he's championed the use of elective hubs, which he demonstrated during a GERD report in March of 2020 for orthopaedic surgery, significantly reduced waiting times for patients, significantly reduced day of surgery cancellations, and also improved efficiencies in those trusts and systems which had access to hub sites. And at national level, one of the considerations has been to establish elective surgical hubs across the country. £1.6 billion of funding was made available. There are now 100 hub sites operational across the country. And as of March 2025, there'll be 135, of which, as Ed has already mentioned, SEOT will be one of the largest. So it'll be a huge asset to our system and our patients. Next slide, please. So what is an elective surgical hub? It's quite clear from the Times editorial on Christmas Day and the piece that Look East broadcast about SEOC in January of this year that our community and patients are becoming more aware of what elective surgical hubs are. And GERF, together with the Patients Association, has created a short 3-minute animated video for patients to explain the benefits of elective hubs. And so if we could run the video, please.
This video explains what surgical hubs are and how they can benefit you. The Patients Association developed this video in partnership with patients and carers and in collaboration with NHS England's Getting It Right First Time programme. What are surgical hubs? Surgical hubs are hospital sites that offer access to common operations and procedures, such as cataract surgery, hip and knee replacements, and other planned procedures. They are typically located in a separated area within a bigger hospital or in a separate building. There may be a hub situated in your local area, or you may have to travel to another area. Surgical hubs are commonly managed by NHS hospital trusts and meet the same high standards of clinical care and safety as all NHS hospitals. Surgical hubs have been operating successfully for years, but in order to provide more capacity for planned surgery and help reduce waiting times, even more have been set up across the country. What are the benefits of having surgery at a surgical hub? Surgical hubs help reduce waiting times for surgery. This may prevent your condition from getting worse and reduce the time you spend managing your health condition at home. Surgical hubs also reduce the risk of short-notice cancellations because they don't take accident and emergency patients. They also bring together experts from all stages of patient care, helping you to go home soon after surgery. How do I know if I can have my operation at a surgical hub? If it's clinically appropriate for you to have your operation at a surgical hub, and it enables you to receive timely treatment, you will either be referred directly or contacted to offer you the option of going to a surgical hub. Once you have been referred, you can contact the surgical hub directly to get more information, ask questions, and learn about what to expect with your surgery. Here are some quotes from patients who've had their surgery performed at a surgical hub. Tackling waiting times is a top priority for the NHS, and surgical hubs are key to achieving that goal and ensuring patients get timely access to the surgery they need.
Okay, thank you, Jared. So next slide. So what's currently happening in SNE and particularly in West Suffolk Hospital, we can see that since COVID, our waiting list has been growing and growing and growing, and that often means that we've not got the capacity to manage the demand, and that's a complex issue, and there are several reasons underlying that. So next slide, please. Since the pandemic, we're also performing fewer joint replacements, and we can see that prior to the pandemic, West Suffolk was performing around 450 hip replacements a year and 350 knee replacements. Clearly, you can see the effect that the pandemic has had on the number of operations we've been able to perform. And since the pandemic, we've been unable to perform the same number of procedures in the hospital. And there are several reasons, again, for this that I'll go into more detail about. Next slide, please. One of the reasons is that our trauma and emergency workload has increased. And this is data from the National Hip Fracture Database showing that from 2015 to 2023, the number of patients with hip fractures we're treating, and this is obviously only a fraction of our trauma workload, has increased by around 30%. And we use the same operating theatres to treat trauma patients as we treat patients having hip and knee replacement surgery. I would like to add that the West Suffolk Hospital is is the best performing hospital in the country with regards to treating patients with hip fractures, with 96% of them achieving best practice tariff, and this is the highest ever recorded figure in the National Hip Fracture Database. So it's an outstanding achievement. Next slide, please. And what happens when we don't have the capacity in NHS hospitals is we rely on capacity in the independent sector or in private hospitals. And you can see data from the National Joint Registry for our local private hospital in Bury St Edmunds. And that hospital is now performing more hip replacements than we perform at West Suffolk. And I often get asked, well, is this just because more members of the community and more patients are funding private treatment? But actually, that's not the case. Out of the 444 patients having hip replacements at Edmunds, 269 are funded by the NHS. So that's 60% of patients having hip replacement surgery at St Edmunds are NHS patients, and that not only has a financial impact for us, but it also has an impact on training, because those cases we normally teach and train our trainee orthopaedic surgeons on at West Suffolk, and if there's no training today, then there's no surgery tomorrow. So next slide, please. So in April of 2022, a business case was approved which enabled the system to construct an elective orthopaedic centre containing 6 theatres and 2 wards And 3 months later, a case was approved to expand the centre's original footprint to 8 theatres and 3 wards, which gives us a huge amount of capacity and is going to enable us to perform 10,000 operations a year. There's already an obvious synergy between West Suffolk and ESNEFT, as both organisations are within the same system, and we've had a number of collaborative events with the orthopaedic teams from the Ipswich, Colchester and West Suffolk sites. And whenever I go to a bookshop or a library, I'm quite overwhelmed by the amount of knowledge that's on those bookshelves. And that's the same when, at those meetings, when I'm with, clinical colleagues who have got a huge amount of experience and expertise, and bringing that together in the centre is going to make a huge, difference to our patients and really benefit them. So based on the capacity available to West Suffolk, it's proposed that approximately 60% of elective surgical procedures move from West Suffolk Hospital in Bury St Edmunds to the Dame Clare Marks building on the Colchester Hospital site at ESNEFT. Obviously, this may fluctuate dependent on case mix, and this would leave approximately 1,300 procedures, orthopaedic surgery on the site at West Suffolk Hospital, including all paediatric orthopaedic operations, all preoperative care in terms of pre-op assessment, and post-operative care in terms of outpatients would be provided by West Suffolk Hospital and in existing peripheral clinics. Next slide, please. And this is the table that was referred to at the beginning of the meeting, showing the appropriate split of activity that we plan to move to the elective orthopaedic centre and the proposed activity that we aim to keep at West Suffolk Hospital. Okay, next slide, please. So the case for change is, under the proposal, this would leave approximately 1,300 procedures in orthopaedic surgery on the West Suffolk site, including all paediatric orthopaedic activity. As we've already mentioned, it's also proposed that the pre-op assessment and the post-operative care and outpatients, including pre-op assessment clinics for West Suffolk patients, would continue at West Suffolk Hospital and existing peripheral clinics. And it's quite clear that due to the size of the waiting list, that the challenge that West Suffolk has in trying to provide emergency care, trauma care and elective surgery on one site, that with the predicted growth rates in our elderly population, then we'll need the capacity at the elective orthopaedic centre to reduce waiting times for our patients. So next slide, please. And what will be the benefits if some of the work from West Suffolk moves to SEOC? With regards to waiting times, by moving patients to SEOC, the West Suffolk predicts that it may see waiting times reduced by as much as 4 weeks. I think we will see a significant reduction in waiting times for patients, and I'll show some data to support that statement on the next slide. The primary focus is on elective care, and by concentrating that expertise on elective care, we'll be able to work in a very efficient way, like a lot of hub sites across the country. And the team on the West Suffolk, Ipswich and Colchester sites are already doing some fantastic work. So we've reduced our length of stay for hip and knee replacement patients from around 5 days to 2 days. So I think it's fantastic that when we move into the centre, we'll really hit the ground running. Revision expertise. So there's a lot of evidence nationally that for more complex procedures, that if those procedures are performed by experienced surgeons in high volumes in those centres, then patients get a much better outcome and have fewer complications. And at the end of last year, ESNEFT was awarded major revision centre status for knee revision surgery. So along with the Norfolk and Norwich, ESNEFT will be one of the 2 hubs for revision knee surgery. And as Ed mentioned at the beginning of the presentation, we plan to use the centre as a regional resource to support patients needing more complex procedures from across the region. As we've already mentioned, it will become a centre of excellence. We've got some, outstanding clinicians, surgical care practitioners, specialist nurses, and members of our teams on all 3 sites that will be coming together with a huge amount of expertise and experience, all working and collaborating together in the best interests of patients. We'll have increased capacity, which will enable us to deliver 10,000 operations a year. And not only do we want the centre to be a fantastic experience for patients, but we also want it to be a fantastic centre for training. Tim Briggs and Stella Viggs' view, shared by Tim Mitchell, the President of the Royal College of Surgeons, is that hubs should be high volume training centres. So it's really important that we're training our nurses, our theatre nurses, ODPs, therapists, other allied health professionals, and surgeons and anaesthetists to do the job that they've worked so hard to do. And by moving activity to the elective orthopaedic centre at Esneft, that will free up capacity on the West Suffolk site, and there's ongoing discussions with the West Suffolk executive team about how that theatre capacity will be used. So next slide, please. So this is the slide I made reference to, showing how moving activity from West Suffolk will significantly reduce waiting time. So this is a piece of work that the Improvement Analytics Unit at the Health Foundation have done with GIRFT. And you can see the graph on the right shows that when high volume, low complexity HVLC activity, so in orthopaedic surgery, this is hip replacements, knee replacements, partial knee replacements, cruciate ligament reconstructions, arthroscopic shoulder procedures, and bunion surgery, which makes up 60% of the volume of our waiting lists. When this is performed at hub sites, then those hub sites can perform 22% more procedures than those organisations that don't have access to hubs. So hubs really do make a significant difference and reduce waiting times. So next slide, please. So I'm going to hand over to Simon at this point, who's going to talk about the proposed approach to the patient and public involvement piece. Thank you.
Thank you very much indeed, Andrew. I'm just going to spend the next couple of minutes talking through the proposed approach that we're looking to take for patient and public involvement. As Ed mentioned at the start of the meeting, the ICB and also the West Suffolk NHS Foundation Trust proposing to run a 6-week public engagement exercise, which will take place during May and June. We genuinely want to listen to people's views on the proposal. And if there are any concerns which are highlighted, not just from people across West Suffolk, but also people in North East Essex as well, to work with local patients and to try and find solutions and overcome any issues that they raise. We are looking to produce an independent survey and a separate analysis report when we've asked both Healthwatch Essex and Healthwatch Suffolk to help us with that. And we have discussed the approach that we're looking to take with the Health and Overview Scrutiny Committee in Suffolk, NHS England, and also with our colleagues in Healthwatch Suffolk and Healthwatch Essex, who are all in support of the approach that we're looking to take here. So next slide, please, Jared. So wanted to quickly run through some of the proposed activities and also timelines as well, appreciating that timelines are yet to be fully agreed. As I say, this is a proposal at the moment. We're looking for the board's support with this. So during April, we'll be working with our Healthwatch colleagues on preparing a pre-engagement activity, namely to write out to patients currently on the waiting list for elective care about what impact the proposal would have on them and whether there would be any barriers or any challenges of travelling to Colchester to receive their treatment. So we'll be looking to work with Healthwatch and also the Trust and their patient group to help us with that. We'll also, in addition, be looking to work with local community groups to ensure that the 9 protected groups as identified within the Equality Act 2010 are also having their say about the proposal, and that we consider the impact that the proposal would have on them as well. A number of staff engagement meetings would take place for Trust staff to find out from them about the proposal, and also to seek their support and influence with the engagement as well. So we'd be looking to work closely with the Trust to ensure that any feedback that they have would be incorporated in the engagement activities too. We'll be looking to have regular dialogue with the Health and Overview Scrutiny Committee. We have got an agenda item on their next meeting on the 17th of July, and also be returning then in the summer to give them a progress update on how the engagement is progressing. We'll be looking to produce a public-facing document as well, which explains the proposal in a bit more detail with some graphs and pictures to support the narrative. And we'll be looking to produce that, not just in standard text, but also have easy read versions and also audio versions to ensure that that document is accessible as possible. We will be producing, with our Healthwatch colleagues, an equality analysis and also a travel plan as well. And we will be, throughout April, promoting the engagement activities and making sure that our plans are in place ready for when the engagement proper starts in May as well. May and June, then, the 6-week period of public engagement will take place, and that will be followed by the post-engagement activity in July, which will consist of an independent analysis report, which I referenced earlier, as well as hopefully agreement at the boards of the West Suffolk Trust and also the ICB thereafter. The next slide, please. And this is my final slide. So during the proposed engagement exercises, we will be running a number of virtual events and also face-to-face events as well. There'll be, as I say, ongoing promotion of the engagement activities. There'll be an advertorial in the local media. There'll be editorial coverage, not just in local newspapers, but also on local radio. There'll be social media messaging as well from the ICB, but also from our partners. And there'll be press releases going out as well at the start, the halfway through, and also at the end of the engagement exercises. We'll be producing posters and flyers. And also, we're very blessed in this part of the world with some excellent support from our local politicians and councillors. So we'll be making sure that we will brief them every step of the way with how this progresses and offer them briefings and updates accordingly. We will also be looking at producing a number of briefings for our patient groups and also for members of the public, including patient participation groups, about how the engagement is progressing, and also through our stakeholder engagement newsletter, we'll be briefing stakeholders as well. And of course, we'll be using platforms that already exist, namely through our parish council and voluntary sector community newsletters, to ensure that those very localised communities are kept fully informed with how this is progressing. So that's the proposed engagement approach that we're looking to take, and both Andrew and I are very happy to take any questions that you may have. Thank you.
Simon, thank you very much, and Andrew, thank you very much as well. Great presentations. Thank you. Just before I open it up for questions, Simon, could I ask you? I'm asking a question here on behalf of the general public, I think. Could you give the board assurance today that the process that you've so well described there, with all that detail, but could you give the board assurance today that the process of engagement will be full, meaningful and transparent?
It absolutely will be. We are looking to make this widespread as far. We will be promoting it very, very thoroughly, making sure that local community groups, as I mentioned in the presentation, are informed, and that we are, as I say, genuinely keen to hear from as many members of the public and community groups as we possibly can with this.
That's great, Simon. Thank you. And Tom, if you could capture that in the minutes appropriately, I think that would be good for board assurance. And final question, Simon. You very clearly explained the time frame proposed, but again, for clarity from the ICB, from our board's perspective today, am I right in asking the question, seeking assurance that we should be receiving the outcome of that process at the July ICB board meeting?
That is certainly our plan to get that to you by the July board meeting, yes.
Brilliant, thank you. Ed, over to you.
Yeah, I just wanted to add that this is obviously the latest chapter in a quite a lengthy and well thought through process. So we've already previously run a significant public involvement exercise with ESNEFT when we were originally consulting for people's views on the elective orthopaedic centre. Health Watch have done extensive work around understanding the public's views around elective waiting lists and how we best support them. So this is really the next step in a kind of ongoing process. And so to your question around rigour and transparency, I believe we've demonstrated that previously, and we just need to continue on that road as we continue through this next chapter.
Yeah, good. Thank you, Ed. Well put. Very, very well put, and good to emphasise that. And Andy and Sam and colleagues, thank you for everything you've done so far, and hopefully will do as well. So let me just then give a moment to see if any hands come up for questions. And I have one. That's Ewan. Yep, over to you, Ewan.
Yeah. Thanks, Will. I haven't really got anything to add to the really thorough presentation we've heard from Andrew and Simon, but just to note that this is a really fantastic opportunity for those people in West Suffolk who are waiting a long time for elective care. So really excellent opportunities to shorten their waiting times and for them to be treated in a state-of-the-art facility.
Yeah. Thank you for emphasising that, Ewan. If we get this right, it's a win-win, isn't it? Andy, over to you.
Thank you, Will. Thank you, everyone. Thank you, Andrew. Thank you, Simon, for the presentation. And Simon, particularly, thank you for engaging me and Health Watch from as early a stage as possible. That makes a big, big difference as you go forwards. As a Health Watch, we can only welcome any kind of intervention such as this to address the waiting lists. And for it to be done in a collaborative way in this respect is great to see. There is some positivity in what we discovered in 2022. So nearly 600 people responded to the survey that West Suffolk helped us with at the time. These were people who were waiting for elective care at the time. And of those 600, 8 in 10 said they were willing to travel anywhere across east of England in order to be seen earlier and to receive an operation earlier, which is really, really good news. There are two caveats though here. One is that there were 15% who were unable to travel or find transport, and they are likely to be physically unable and or very likely to live in some degree of poverty. So when the quality impact assessment is carried out, and I think it will verify this, we need to think really carefully about who ends up being invited to receive the operation in Colchester, should that happen, and who is invited to receive that operation or something similar at West Suffolk, which may be closer to home. So that was one point I wanted to raise. And of course, the other one is there is a knock-on effect potentially, which we need to be aware of and communicate with the public. And Simon knows this. For those who are waiting in North East Essex, for instance, will there be an impact on their waiting time with West Suffolk patients being seen at Colchester? And that would need to be addressed as well. But thank you for allowing me to speak.
No problem, Andy, and thank you for making that point about the travel challenge and the appropriateness of the geographical service taking into account travel challenges and so on. Point well made. Let me go to Andy. Over to you, Andy.
Yeah, thanks. Well, I mean, it's just to say to Andy that Nick Hume was very aware, of that, and certainly mentioned that in his Look East interview. I think it's a question of shared learning with colleagues from Royal Papworth who clearly, have patients visiting from all over the region to have, care at their excellent facility. And I was part of a team lucky enough to visit the Royal National Orthopaedic Hospital at Stanmore as part of their hub accreditation visit the other week, and they have patients, travelling from all over the country to have, specialist orthopaedic care there. So there's a lot we can learn from other hub sites, and that's the beauty of the hub accreditation scheme. It's a real opportunity for sharing, learning and best practice, and making sure that we don't exacerbate existing health inequalities.
Absolutely. Well put. Well put. Okay, colleagues, so I don't see any other hands raised. So shall we try and see if we can get to a position of consensus on the resolutions that we're asked to approve today? The board's had a full and frank discussion, received great presentation as well. Oh, by the way, Tom, would you be okay to take an action to circulate the presentation and the video link to board members after the meeting? I think that people would appreciate that. Some great information in there. But noting that we've had a full discussion and that we don't appear to have any disagreement with the process as described, noting that HOSC have approved the process as it has been described to them, and noting that we have NHS England support in the same way, is the board is asked to consider two resolutions today. First of all, it's A in the paper before you. The public engagement process is approved as outlined in the paper and the presentations you've received today. Does anybody disagree with that? And I see no hands raised, so shall we take it that is unanimously approved? Thank you very much, everybody. And then secondly, that the board remains cognizant at this point in time of the ongoing discussions that there are pertaining to the to be agreed financial and activity model to be pursued. And again, shall we say, I think in that case, noted, received and noted. Everybody content? Good. Thank you very much, everybody. I think then we are 7 minutes late. Many apologies for that, but there was some great information in those presentations. Thank you. The only other item is any other business that anybody might have. None has been notified prior, and I see no hands being raised. Therefore, at 17:52, shall we close the meeting and look forward to our next meeting on the 26th of March. So thank you very much, everybody, and good night. Thank you.